Good afternoon, everyone. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for Tuesday, November the 16th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Of course, today we're here to provide an update on COVID-19 and answer your questions, but I wanted to first share, and I know I speak for everyone in BC, my deepest gratitude to emergency crews, healthcare workers, health authority employees, BC Emergency Health Services, and ministry staff for everything they've done over the past couple of days to keep people safe. This includes a significant efforts to safely move patients and residents of long-term care and assisted living out of flood areas. About 150 have been moved so far, principally from Merritt, and another 48 are expected to be moved in Princeton in the next little while. Those are significant and difficult things, and especially our teams in Interior Health have done an extraordinary job, I think. Paramedics were there yesterday to assist those being evacuated by helicopter on Highway 7. Whether our lives have been directly impacted by these events or we have seen their impact on others, what has touched all of us and will continue to as the recovery proceeds are the efforts of emergency and healthcare teams, local and regional governments, volunteers, friends, strangers, and passersby who have offered a handout, support, hands of assistance, and other welcomes, supports, and comforts in evacuation areas. All British Columbians are thinking of those who've been impacted by the heavy rain, severe wind, and significant flooding, and respect their strength, resilience, and courage. Minister Farnworth will continue, I believe, later today to have updates on the flooding impacts with ministry and emergency officials. With that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. I also would like to start by recognizing the communities that have been affected by the recent flooding and landslides across much of the province over the past few days. And I'm very grateful for very strong community support that has helped people get through this and the heroic work of our emergency services. I have a meditation teacher that used to talk about this too, and sometimes it's a challenge for us that we have been through so much in this past year and a half, and now this too. But it is our sense of community and strength that will keep us strong and get us through this one as well. In this global pandemic, we have learned as much as we can from watching what's happening around the world. And currently, watching what's happening in Europe and the UK has meant that we have had to look carefully at what we're seeing here in British Columbia as well. If we think of Austria and Germany and the Netherlands, Finland, it reminds us that we are not yet through this pandemic, and we need to take a slow and measured response. Last week, I was asked about new potential variants of concern in our province, and particularly we talked briefly about the Western lineage that has been seen in BC and Alberta and Saskatchewan. And today I'd like to report that we've had our first confirmed cases of the AY 4.2. So this is one of the Delta sublineages, and we talked last week about the fact that as the virus replicates and infects more people, it mutates. And there are now about 120 different sublineages of the Delta strain of the virus around the world. And we've seen here in BC, and as mentioned across the West, the AY 25 and 27. And these were first found in British Columbia around June, and now is about 2/3 of the cases that we're seeing. All viruses mutate, we know that, and development of these new lineages, which are unique to geographic areas, are really expected over time when we have ongoing transmission in our communities. We are watching closely, particularly now with these new cases of AY 4.2, and this was a specific mutation that's been found in the UK. It's not yet its own variant of concern, and it's one of the other things, the language and the nomenclature of how we're naming these lineages and clades and subclades has been changing as well. But we are continuing to follow the whole genome sequencing and making sure we're aware of what strains are being transmitted here in British Columbia. What we are looking for is whether these variants of interest and concern are spreading more quickly or making people sicker. And of course, we're watching very carefully to see if they're associated with less effectiveness of the vaccine. So far, what we have seen and what we've talked about over the last number of weeks is the fact that the strains of the Delta variant that we're seeing are spreading much faster and causing more severe illness in younger people, and that remains the same. And our best defense continues to be being vaccinated. We're now starting to receive a small number, and we received our first shipment of the Johnson & Johnson or Janssen vaccine. It's a viral vector, single-dose vaccine, though we likely are going to need a booster dose at some point. But as I mentioned last week, our priority is to make this vaccine available to people, healthcare workers who are affected under the provincial health officer order, who wish to be immunized and are currently on leave so they can return to work. However, we expect that we will be getting some more in and that we will have more than we need to address the needs of healthcare workers affected under the PHO order. So if you are somebody that would like to get this vaccine, the way to do that is to contact Immunize BC call center at 1-833-838-2323 and let the agent know that you'd like to be put on the wait list for the J&J or Janssen vaccine. You will be transferred to what we call the complex cases line, where your information will be collected. And if you are a healthcare worker, let the agent know that as well. And then once we have an understanding of how many of people affected under the PHO order require this vaccine, we'll be contacting others to connect you to doses in your community. I would like to reiterate that we have about 5,000 doses that have come into the province just this past weekend. And so that's what we'll be working with right now for the next couple of weeks. But if this is of interest to you, then I encourage you to call the IMSBC contact center. I also want to take a moment to talk about immunizations for children 5 to 11 years of age. We anticipate that Health Canada will likely be coming out with their recommendations around use of this vaccine for children very soon. And we have been reassured that there will be enough vaccine for the just over 300,000 children in this age group here in British Columbia. We expect that Health Canada will make their decision after a thorough process to review all of the data. We've seen that the importance of this independent review of the safety and how well the vaccine works, the effectiveness of this vaccine for children, and we are counting on Health Canada to continue to do that due diligence with this vaccine, and I know that they are doing that right now. And the National Advisory Committee on Immunization is working closely with them to look at all of the data on this vaccine and on children, and will issue their recommendations at the same time as Health Canada recommendations come out. So that's great news. That means that we'll have that thorough, independent review that we can rely on for making decisions. I also want to talk a little bit about this vaccine. We've said a few times that this is a version that is designed specifically for children. It has a smaller dose, about 10 milligrams, in a smaller amount. And that will mean less pain and discomfort with the shot. But also it means that this is tailored for the immune systems of younger children so that it doesn't cause as much side effects, and it can be strongly effective as well. So those are good things. I think it's important for us to recognize that we had these vaccines that have come out and been used in millions and close to billions now of people around the world, and we know a lot about them now. This is, and the extension of this use to younger children has now been done in a way that specifically looks at how the immune system of young children respond to the vaccines and respond to any vaccine. We know that younger children have good, strong immune systems for the most part, so they don't need as much of an antigen boost. We've also known, and I was talking with my colleagues from the United States, and they have rolled out the vaccine program for young children in the U.S., and we're getting lots of great information on safety and how well the vaccine is working there. If and when it is approved and we start to receive doses in BC, we'll be starting to contact parents who have registered their children. And this is a good way to make sure that you can get access to the vaccine as soon as it's available. So by registering now, your children will likely, we expect, be able to receive this vaccine before the upcoming holidays. And I encourage parents to think about this now. Of course there's concerns. We all want to make sure that we're doing the best for our children, and we want to make sure that these vaccines are safe and are going to work. So speak to your family doctor, your pediatrician, your pharmacist. Get that information that will help you make those decisions about what's right for your child. Use some of the established incredible resources that we have. We have information up to date so far of what we know at the BC CDC website. And I encourage people to as well go to the tool hashtag It Does Not Have to Hurt. This is a program, we have expertise in Canada that has been involved with looking at how do we get vaccines in a way that's safe for children and minimizes the pain and the concerns that children have in their vaccination programs. There's some really good information on this that can help parents and children understand what to expect and how to prepare for receiving their vaccine. These are excellent resources that make the experience better for your children and for you. I also encourage parents to talk with the young people, their children, to understand their concerns and to help prepare them. These are things that we can do that can support our families and our communities. And we often don't know exactly what the anxiety are that young people have or what they want and their preferences are around vaccination. So as these vaccines are coming, we will be providing as much information as we can about how the vaccines work, how they work in young children, what we're seeing in terms of side effects, and how to prepare. But I encourage people now to start looking at this to be able to support your children in being vaccinated so that we can protect them. We know that for the most part children have milder illness, but we can't tell which are the children necessarily who are going to have more severe illness or are going to develop longer-term concerns and complications from COVID-19. Vaccinating children in the younger age group will not be mandatory, but it will give your children as much protection as possible. The best path to immunity is not through illness, it's through immunization, and I encourage parents across the province to start looking into that now. As well, I want to say that our influenza immunization campaign is going ahead. As we know, we have started to see some more cases of influenza in the province. We've had about 27 confirmed cases, but most of them are in children who've received a vaccine, so that's good, or are travel related. So the number of cases that we're seeing is still small, but we know that that can grow quickly. That's why I strongly encourage everyone to get their flu vaccine before we get too far into the holiday season, especially if you're going to be around people who are immune compromised or are older people in our lives. Like COVID-19 vaccines, influenza vaccines protect you and protect those around you. Finally, I want to talk a little bit about masks. We've had some updated information that the Public Health Agency and Health Canada have posted about masks, and as we've been moving through this pandemic, we've been learning more and more about the importance of that extra layer of protection, particularly in the winter months when we're moving indoors. As it gets colder and more of our activities move indoors, we come into closer contact with others outside of our household, and that means risk goes up, and particularly in settings where there's more of us crowded together, where the ventilation is not as good. Masks become one of those incredibly important safety layers that are particularly important as we move through this winter season. And the mask, one of the things about masks is the layers. The best mask is the one you are wearing and wearing correctly, the one that comfortably covers your nose and mouth and chin. And if you have underlying health conditions or immune compromise, then you might want to choose a medical mask. And this is more information that we're finding, is that medical masks do have that extra layer that attracts particles and droplets and viruses, which is why they can have a better filtering effect to protect you from breathing in viruses. They are also certified. Medical masks and respirators are certified by Health Canada, so they have to meet specific standards. However, we do know that they can be challenging for people. They can be irritating and they can cause it to be more difficult to breathe. So if you choose to wear a non-medical mask, then we want to make sure that you're wearing one that has the number of layers of protection, that it fits snugly around your nose, and that it has at least 3 layers, and that can include a filter layer in the middle, and that it's made up of tightly woven fabric. So I'd encourage people to have a look at the new guidance and some of the information around masks that are on the Public Health Agency of Canada website. The other option that people can take is to wear a medical mask and a non-medical mask on top to help improve the fit around the mouth and nose. It's been a strong recommendation for some time, but as we're moving into the next few weeks, it is important, particularly as we head into the holiday season, that when we're indoors in public places, when we're indoors around other people, that we, as many of us gather to celebrate important religious events, for example, we want to ensure everybody has the best protection possible, and that includes, right now, being consistent in wearing masks when we're in indoor spaces. Yesterday, the Attorney General announced the intent to introduce a bubble zone around schools and healthcare facilities. Safe, unrestricted access is critical for everyone receiving an education or requiring care. So I just want to add my commendation to the Attorney General for this decision. I know it is important, and I think it's an important piece of legislation to protect our healthcare services and our education and schools. So to sum up, the pandemic is still very much with us, and we must all continue to proceed with caution. We're closely watching what is happening elsewhere in the world as other countries experience surges in new cases and the strains on their healthcare system. We have been there, and we continue to have strains on our healthcare system here, but none of us wants to get to that place again. It's going to be challenging to get us through this winter, but we know what we need to do, and we can do it together. That's why I'm asking all of you to keep our walls of protection and our layers of protection strong. We need to support each other, to do our part, to encourage each other to get vaccinated, to get the information we need to make sure we can make that right decision, and to do all of those things which will help us get through this winter. That means, of course, staying home when we're ill, keeping our groups small, choosing outside instead of inside, washing our hands regularly, and making sure that if we're particularly to honor our seniors and elders and those amongst us who are immune compromised, to make sure that we are vaccinated so that we're not putting others at risk and we're keeping safe ourselves. Thank you very much.
Thank you very much, Dr. Henry. And we have, I just have a few updates with respect to vaccination and surgeries and influenza vaccines, and then we'll move on to questions. Firstly, and this is, if you look nationally or internationally, extremely good news. 4,209,074 people in BC have received their first dose immunization against COVID-19. That's 90.7% of all those over 12. 4,026,399 have received their second dose or fully vaccinated. That's 86.8%. The number partially vaccinated is now under 4% who've received one dose but not their full course. And now, of course, with the addition of booster doses for many vulnerable British Columbians, we've done, in terms of third doses, sometimes called booster doses, 242,000 460 of those. That's about 5% of the BC population, but importantly, almost 150,000 of those for people over 70. That's 20% of that population, and certainly, I would say, shows the significant efforts that continue to be made in this period to make sure that our most vulnerable people in BC are safe. Just an update with respect to the vaccine status of health authority healthcare workers. This excludes long-term care staff. The total number of all those unvaccinated is 2,885, which is down again. But importantly, and just as importantly, because of new additions as well, 125,190 fully vaccinated and 1,265 partially vaccinated. The fully vaccinated number continues to increase across the system. So that means basically 98% vaccinated, 97% fully vaccinated, 1% partially vaccinated, 2% not vaccinated. And of those not vaccinated, 974 are casual employees, 942 are full-time, 15 not specified in our data here, and 774 part-time. So we continue to make progress with respect to the vaccinating healthcare workers, and the fact that 126,455 have been vaccinated demonstrates the strong support from healthcare workers for those efforts and for keeping everybody in healthcare, and by extension patients and residents in long-term care, safe. Those efforts continue. I want to report on the numbers of influenza vaccines that have been doses that have been administered in BC. That's 721,246 doses, of which 533,417 have been done in community pharmacy. Those numbers, there's a little bit of a lag time in reporting sometimes, but that is a significant progress in our influenza campaign. I just note that 2,039,000 doses of influenza vaccine have been distributed across BC to community vaccine providers, both in health authorities and in community pharmacy, and that effort continues while all of these other efforts are taking part in healthcare, and we want to particularly give a shout out to all those in community pharmacy who are supporting those efforts. It's a significant, I think, and continuing achievement. And as you know, in the past, less than 50% of influenza vaccines were administered by community pharmacy, and as you can see by the numbers, it is a very significant majority of those vaccines now being delivered in community pharmacy, and we are both appreciative and grateful to all those who are working on that campaign, and encourage everyone to get your flu shot. I wanted to just report on contact tracing that over the past week an additional 37 staff have been added to support contact tracing. That's for a total of 1,632 as of November 12th. To put this in context, in May of last year, when we had more than 10,000 active cases of COVID-19, we had 1,563 contact tracers in place. We've now surpassed that number. And with respect to surgeries, since May 2020, as you know, we made our surgical renewal commitment to patients. We've shared news on our progress. Sometimes the progress, as you know, has been extraordinarily strong in that period, and our teams have done an amazing job. At other times, when COVID has fought back against our efforts to stop the spread, our progress has been tempered by great challenge. Our weekly reports, I think, are encouraging for this reason. They show how all those involved in delivering surgeries, week in and week out, especially when challenges abound and setbacks seem insurmountable, get patients the surgeries they need. Each week, all those involved in delivering surgeries do just that. They deliver surgeries, and each week is my honor to report on their unyielding achievement. This week, we continue to face challenges in interior health. COVID outbreaks at Royal Inland Hospitals have caused a reduction of 6 operating rooms. While the outbreaks are managed, 3 operating rooms remain open for emergency surgeries, urgent cancer surgeries, and urgent C-sections. We will resume scheduled surgeries at the hospital when it is again safe to do so. That has always been our commitment, and it remains our commitment. To that point, Northern Health, which has faced significant challenges from COVID-19, is slowly increasing surgery at University Hospital of Northern BC in Prince George and at Dawson Creek District Hospital. We know, I know, how important every surgery is to patients and their families. This news out of Northern Health shows that where we face challenge and experience setback, we make every effort possible to get patients the surgeries they need. At the same time, and I want to say this is something we reported on consistently, 123 critical care patients have been transferred out of Northern Health since September 5th. The vast majority of those have tested positive for COVID-19. The vast majority of those are unvaccinated. And the efforts in other health authorities to support Northern Health continues, and we are proud of those efforts and proud of all of our extraordinary teams in Northern Health. With that, here is this week's update on our surgeries. Some surgeries continue to be postponed during the reporting period November 7th to November 13th. Health authorities postponed 174 non-urgent scheduled surgeries. That's 43 in Fraser Health, 3 in Northern Health, 25 in Vancouver Coastal Health, 21 in Vancouver Island Health, and 82 in Interior Health. No surgeries were postponed in the Provincial Health Services Authority. So cumulatively, from September 5th to November 13th, there have been 2,845 surgical postponements. Despite these postponements, surgeries are continuing across the province. I want to update the numbers because we had full reporting for the period October 17th to October 23rd, our last full period of reporting. Health authorities report in that period that 7,148 surgeries were completed. That's an update from last week. This is 1,217 more surgeries than the same week in 2019, although that week in 2019 included Thanksgiving. But whether they're delivering surgeries, providing critical care, or ensuring emergency departments are there for it, our healthcare teams can't do it without us. Our continuing effort to stop the spread, our effort to keep our healthcare system strong. I want to say, just in terms of capacity of our healthcare system, you'll know if you're listening to these reports that we have about 9,229, exactly 9,229 base acute care beds in the province. We have 2,353 surge beds in addition to that, for a total of 11,582. As of Monday morning, 9,137 beds were full. With patients, so that is almost all of our base acute care beds. In critical care, we have 510 base beds, 218 surge beds, for a total of 728. And as of Monday morning, 459 of those were full. Those numbers in the course of a week will bounce around somewhat, but it just shows how intensely busy our healthcare system is and how much all of us need, all of us, to do our job, which is get vaccinated, get our flu shot, use our COVID sense, follow public health guidance. When we do our job, we make a difference in the life of everybody in the healthcare system and the lives of all those people who, for of significant variety of reasons, need help in the public healthcare system today. I ask everyone to get vaccinated against COVID-19, get your flu shot, and stay safe. And we're happy to take your questions.
A reminder to media on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. Our first question today goes to Richard Zussman, Global News.
Dr. Henry or Minister Dix, I'm just trying to get a sense of, with the floods and slides, what impact it may have on the way that we're trying to move vaccine around. Are there any concerns that vaccine will not be able to get around the province to the places they are needed? And Minister, you mentioned Princeton eventually will have to move patients. What challenge is this having on the healthcare system now in terms of how many patients are having to move around? And are we worried that these are populations that have higher percentage of unvaccinated people and that COVID may be moved around the province and lead to increased spread because of this movement due to the disruptions due to floods and slides?
Yeah, obviously that is a worry, and it reinforces the importance of not only being vaccinated, but all of the other measures that we know are important when we're in those enclosed settings, and whether it's on a bus, being moved between places, whether it's in a reception center, making sure that we are keeping our distance from people, wearing masks appropriately, and supporting each other through this very, very challenging time. In terms of vaccination, in vaccines. Yes, there has been some challenges. We received our shipment of Janssen, for example, of the J&J vaccine on Friday, and there was some delays in getting it into the interior over the last few days, but it has arrived, and we have different ways of doing that. So it has meant taking alternative measures in some communities to get things. Obviously, I think it's the rest of us are now disconnected from the rest of Canada for a little while with the damage to the roads that we've seen. So we have alternate ways of getting vaccines into communities, and the clinics are continuing in many communities. Obviously, in those areas like Merritt and Princeton, in some of the places in Abbotsford right now, there are other priorities, and we're focusing on supporting people to get through those as well.
And Richard, Mr. Farnworth will be reporting on some of these things in detail. What I can say about the patients, not the patients, the residents of long-term care, in some cases, home care recipients in communities most severely affected, including Merritt and in Princeton, that the total number of patients and home care residents that have been moved is 150, and that are expected to be moved a further 48. And that doesn't seem like a lot of people, but in many cases, we're talking about people who are extremely vulnerable. And in the case of people in Merritt in particular, a group of patients in, or should I say residents of long-term care who have already had to move this summer in the course of the evacuations around the wildfires. And I just want to say that we're thinking and supporting those residents. Our extraordinary health care teams are helping them. I want to say to their families, we're continuing to work together and to keep you informed of the progress we make. But it's a very, very difficult thing. And I just want to pay tribute to all of our teams in Interior Health, from Susan Brown to the people on the ground who are helping move people today, how much we appreciate their work. Interior Health has dealt with a very difficult period related to COVID-19 with wildfires that involve significant evacuations, including through Kelowna, the Kelowna Airport and down to Metro Vancouver, and now more evacuations. All of these things have faced Interior Health, and I want to pay tribute to the strength, the bravery, the determination of our teams in that area, because they have faced these challenges and really been there for residents in long-term care, residents in assisted living, patients in acute care from the beginning. But those are the changes, and of course, amongst those groups of people, healthcare workers, 100% are fully vaccinated. Of the residents, almost all have received, or the vast majority have received, not just first and second dose, but third dose plus their influenza vaccination. So that group of people vaccinated with respect to others. Obviously, everyone needs to be prudent in these times, but I think our healthcare teams are doing extraordinary work, and Minister Farnworth will have more to say on this later today.
Richard, do you have a follow-up?
On AY 4.2, Dr. Henry, I think indications in the UK are it's slightly more transmissible. What does this do in terms of our strategies against COVID-19? Does it continue to be the same measures post-vaccine, or do we need additional steps in order to accommodate for evolutions like this?
Yeah, so right now it's a watchful waiting and watching what's happening with this specific sublineage in the UK as well, and yes, we are re-looking, as I've sort of been hinting over the last little while, about what are the things that we need to do, all of us, to get us through this next few months, regardless of which strains we're seeing circulate. It's all Delta around the province, as I've mentioned, and a large proportion of what we're seeing is the AY25. So our strategies need to be the same. It just reiterates the importance of recognizing that the strains of Delta are spreading much more easily, and those indoor crowded environments are where it spreads even more rapidly. So we need to use every layer of protection, from staying away from others if we're not feeling well ourselves or if we've been exposed, making sure that we're vaccinated, particularly if we're around people who are immune compromised or who don't mount as strong an immune response, so the elders and seniors in our lives as well. and making sure that we wash our hands regularly, keep that safe distance from people, and keep groups small as much as we can.
Next question, we go to Ben Milger, CTV.
Thank you very much. Minister Dix, what can you tell us about the physical infrastructure of care homes and other healthcare facilities like hospitals that were damaged by floodwaters in Merritt and elsewhere?
And it's not just in Merritt, of course. We've had some impact of flooding in different communities around the province. A number of healthcare facilities have been affected from Port Renfrew to Saanich to Merritt and so on. So I'll have more to report, and I'll provide some details on all of that as it develops. We're obviously managing, but in places, communities such as Princeton and Merritt, full evacuations have occurred, and we'll have more to report later on the physical impact of it. But obviously on our staff, and that's our main concern, our staff, our residents, and our patients right now, it has significant impact, and you're seeing that reflected in the decisions to move people who, under ordinary circumstances, wouldn't want to move, and this is the second occasion for those in Merritt. So we're thinking of that and making sure everyone's safe right now, and obviously securing the physical infrastructure. I'm happy to report to you, and if you want details on particular facilities, because there's a fairly long list that's been affected either in small ways or in larger ways, so I can provide that to you.
Ben, do you have a follow-up?
I have a second question. This is for Dr. Henry. Dr. Henry, some healthcare workers who got their second shot 6 months ago but still aren't yet eligible for their COVID boosters are actually traveling to the U.S. to get that shot, and others are keen to get a booster ASAP as they're exposed to the virus in their workplaces. Why aren't you offering them the opportunity when Ontario is doing so, and we seem to have so many doses available?
We are, absolutely, and we have started in terms of healthcare workers with the people who are most at risk, so in the ICUs, emergency departments, on our COVID wards, and people who receive the vaccine early. So that means healthcare workers in long-term care who were prioritized first, and people who received it at the shortest interval. So those are the people that we've started already, and we are now moving into people who work in the hospitals. So there's a whole process over the next number of weeks where people will be receiving their invitations, and I encourage people who receive their vaccines early on to make sure they're registered on the Get Vaccinated website, and you'll receive your invite in the coming days and weeks. So when we announced the program a few weeks ago, that's absolutely part of the plan. So we expect that all healthcare workers will be completed as we head into Christmas.
For the next question, we go to Rob Brown, Dawson Creek Mirror.
Good afternoon. Thank you for taking the call. Not to get into too many stats, but back in September, support for those relying on proof of vaccination certificates in the workplace was about 65%. Now it's closer to 70%. Wanted to get both the PHO and the health ministers, to speak to that as a potential next direction as far as getting British Columbia and as well as businesses through the winter.
So you're talking about employer mandates for employees?
You bet.
Yeah, so we do know that that is something we've been recommending for many, many workplaces. It's part of the Public Service Agency has required it here in BC. We've seen many workplaces, many large banks, a number of the industrial camps that we've seen in across the north and interior. So actually it is a really important way, and we've seen it increase vaccination rates for particularly younger people who have been at risk in their workplaces. And here in BC, we started very early on in prioritizing some of these higher risk workplaces. food production, for example, where we saw some very devastating outbreaks, and people who were more vulnerable, were made vulnerable by the conditions that they lived in and that they worked in. So we prioritize those populations. We've seen very high uptake in grocery store workers, in poultry workers, in other workplace settings. And yes, this is an important way to ensure worker safety in workplaces, and at this point in time to make sure that we're doing everything we can to keep our workplaces open and functioning, because when we have outbreaks in those settings, we need to close them down to prevent that transmission to other workers in those settings. So it is one of the measures that has been proven to be effective and that we support. And of course, as you know, under the provincial health officer orders, we've made that a requirement for all healthcare workers in the province.
Well, I think it's having a very positive effect. I mean, what we've seen in the last number of weeks, I think when I reported last week, it was around 10,000 new first dose immunizations in that week. I think we had a statutory holiday on November 11th, of course, and that made it was slightly less last week, but still a very significant number of new first dose immunizations. We're at 90.7%, and when you're focused in on the remaining 9.3%, that's real progress, continuing progress we're making in that first dose immunization, and a lot of that has to do with the effectiveness of the mandates that have been brought into place. As I reported in my main report, 2,885 healthcare workers remain unvaccinated. Well, it's over 126,000 who have been vaccinated, and the number of unvaccinated healthcare workers has declined, as you can tell, week unto week by quite a significant margin. And we see this across sectors. I think in your region in particular, the efforts of the municipality in Fort St. John, for example, have been, I think, exceptional in promoting vaccination. It's now at 78%, and we think we continue to close on 80% there. And mandates in workplaces assist with that and support people in that. And we're going to continue to push community by community and person by person to see those rates rise, because when they rise, we're all safer and we're better prepared to deal with what's going to be a challenging winter in healthcare. So mandates have worked effectively. Under provincial health orders, they've been focused on healthcare, on the healthcare sector. But overall, all efforts to encourage vaccination have, I think, been positive. And you see that in the results over the last 2 or 3 weeks, which have been really positive in pushing first dose immunization. And of course, second dose immunization, that gap is closing. It's now 3.9%. And as of today, 20% of all those over 70 have been vaccinated, 16% of all those over 65. So you're seeing the progress on vaccination across the board, but it is a huge effort. Contact tracing, vaccination is a huge public health effort, and the support we're getting from the private sector, I would say, from unions, from businesses, has been exceptional in promoting that, and we're very appreciative.
Rob, do you have a follow-up?
You bet. Just over the last day or so, Austria is taking the steps of announcing lockdown and restrictions for the unvaccinated only. Is this something that is in the British Columbia playbook as far as a strategy moving forward, and is that something that we could see in this province moving forward?
It's not a strategy that we're looking at the moment. I think it's important to say that we've had to adjust our strategies as we've seen things evolve. In what we're seeing here, I will say that even in most communities, even in communities where we have below the average immunization rates, we're higher than some of the communities that they're seeing in Austria. So we are focusing on, as I've been saying probably way too often over the last year and a half or 2 years, the layers of protection that we need. So the BC vaccine card is going to be an important tool to help us get through this winter so that we can come together safely, we can have businesses open safely, and mitigate the risk of transmission if everybody in those settings is vaccinated. And as we see those types of requirements in more and more settings, that makes it helps put a damper on the transmission that we've been seeing in communities. So that is an important tool that is going to be in effect through this winter. And we're going to be looking at making sure we're optimizing it. I've talked quite a bit over the last few weeks about now's the time where masks become important again, as that important layer of protection when we're indoors in particular, and when we're around people that we don't have usual contact with and we may not know. And we know those indoor spaces are the highest risk spaces. That's why we have the mask mandates in those spaces. That's why we have the vaccine card apply in those spaces. So it is making sure that we're optimizing those tools that we have in place now. There are additional restrictions, as you're well aware, in the north because of the rates of transmission. And in the north, the interior and Fraser East, we're looking very carefully at things like the immunization rates in that community, in each community. We're looking at the transmission rates. We're looking at the use and the support for things like the vaccine card and vaccine mandates to help us determine what is needed as we go through this next few months. But the reality is, if you're having gatherings, particularly family gatherings as we're going into the holiday season, and you have people who are immune compromised, you have elders or seniors in your group, then only be vaccinated. That's the best you can do to show them respect, to protect them, because we know that even with booster doses, some people are still vulnerable, and we all as a community need to do our best to protect them.
Next question, Rob Monroe, Info News.
Hi, thank you for this. I think this is for Minister Dix. You talked about the 6 hospital operating rooms closed at Royal Inland and 3 were operating. I think last week there's 2 closed in Kelowna General. Are those open in Kelowna General? And how many of the 81 surgeries for the interior are in each of those hospitals?
I think the challenges facing those hospitals are obvious. The reason is a reduction in operating rooms at Royal Inland is to manage obviously the significant outbreaks or 4 separate outbreaks of COVID-19 in the hospital, and ensure we provide a high level of services. As I noted in my presentation to you, several of those operating rooms are open for emergency surgeries, and those continue to happen. There continue, I believe, to be 2 closed at Kelowna General Hospital. Both of those hospitals, in terms of their base bed capacity, are over 110% of base bed capacity. So they're, and in the case of Royal Inland, above the base and surge bed capacity. So those are 2 extremely busy hospitals. It's the reason why these measures were put in place. They're to protect staff and to protect patients, to maintain the highest quality of care. So the significant majority, I probably get you the exact number, Rob, but the significant majority of those surgeries would take place the most significant surgeries take place at those 2 important hospitals in any event. And so a majority of those surgeries canceled would be, if not almost all of them, would have been canceled at Royal Inland or Kelowna General Hospital, the ones that have been delayed in interior health. But obviously, this affects our ability to advance surgical renewal, and this happens, but it's a necessary step both at Royal Inland and Kelowna General Hospital. As you know, Rob, the staff there is doing just exceptional work under the circumstances, and we intend to get surgeries back up and running as soon as possible. But that reflects, I think, people often ask in terms of interior health about the situation there, because we've seen a very positive evolution, I'd say, in many ways. And on August 18th, test positivity was about 14.6%. It's about 6% now. So we've seen cases come down overall, but hospitalizations, which are a lag indicator, remain high, and we really need to continue to do the work together in the community and to support our healthcare teams in interior health, so that we can deal with all of the healthcare issues that people in interior health need. And these are, with the floods, with all that has gone on in interior health, really challenging times. So I really encourage everybody to get vaccinated and support that effort, both against COVID-19 and get their flu shot right now. And we're going to get those operating rooms open as soon as possible. And we'll get you, I think, some more detail on that. But basically, it is those 2 hospitals, and those 2 hospitals are the ones that are seeing the most significant census against base bed population in the entire province.
Rob, do you have a follow-up?
Yes, along the lines too, the part of this is the vaccination rates in interior health were particularly low. and you gave the overall rate for healthcare workers. Do you have a breakdown of where the interior is in terms of their vaccination rate for healthcare workers?
Yes.
I do.
Numbers man.
Yeah, I do, Rob, and we're making significant progress. There's a real effort going on in interior health to both encourage people to get vaccinated and to give them people access and quick access to vaccination. So by health authority, of the 2,885, the numbers are 911 in interior health, and you'll recall, I think that was roughly 1,300 a couple of weeks ago. So 911 in interior health, 534 in Fraser Health, 289 in Northern Health, 92 in Providence Healthcare, 363 in the Provincial Health Services Authority, 325 in Vancouver Coastal Health, and 426 in Vancouver Island Health. That's down to 4% not vaccinated in interior health, 4% not vaccinated in Northern Health, and either 1 or 2% in the other health authorities. So that's significant progress and continuing progress. And I think it's a real focus of interior health, and I think we're going to see more progress in terms of the vaccination of healthcare workers in the coming weeks. Overall, as you know, about 86% of people over 12 have received their first dose immunization, COVID-19 immunization across interior health, but it varies as to communities. Some communities are very high, such as Revelstoke and downtown Kelowna right now, relatively high against the overall population. Other communities, such as Enderby, are lower, and we're working hard to raise vaccination rates there.
Next question, Rob Buffum, CTV Vancouver Island.
Oh, thank you. I was wondering if you could provide us, Dr. Henry, with a bit more context in terms of the A1 4.2 mutation, I guess confirming that it is thought to be more transmissible if that's the case, and just how concerned you are given what's happened in the UK. Might this, change things significantly over the course of the winter here in BC?
Yeah, so I think it's a reflection. It's not a surprise to us when we see this virus moves with people, and when we have a lot of transmission of the virus, it mutates, and it mutates not as fast as viruses like influenza, but it does change over time. So when you have a lot of transmission in a community, you're going to get changes over time. The cases that we have of the AY 4.2 are in the Fraser Health region right now, and we're doing contact tracing as we do for all cases to see where they might have acquired it. These are the first ones that are not travel related, but we know that this is going to happen. So it is a concern, but it also reflects that we've been watching for what strains are causing illness, and we're following that really carefully through the whole genome sequencing. So you can see that posted weekly on the BC CDC website. I think the other challenge we have is that, as I mentioned, is that the naming conventions that we have for all of these variants has been changing, and it changed in early spring, and it changed again through the summer. So what we call one thing today may be associated with what we called something different just a few months ago. So that part of it is a little bit confusing and challenging for people. But in the UK, they are still watching this. It has another mutation. So far, they have not seen it cause any reduced effectiveness of vaccine. And of course, that's something that we're watching really, really carefully. They have seen slightly increased transmissibility, but all of the Delta sublineages, clades, or strains that we're seeing here in BC are definitely higher transmissibility than the ones we were seeing even a few months ago. So this is something for us to just be aware of and to watch. And it reflects, of course, that we need to do our piece as global citizens to reduce transmission everywhere, because where there's pockets of increased transmission, that's when these virus strains change and can confer an advantage.
Rob, do you have a follow-up?
I do. I take it from your remarks there that there's more than one case. It's cases. I don't know how many cases there are. If you could
cases.
I just wanted to also say, in terms of the medical masks, I guess my primary question is your recommendation now that that all of us wear medical masks ideally, or is it just those who are immunocompromised? It sounded like you were talking about it would be an advisable idea for everyone if we could.
Yeah, I'm a little bit conflicted about medical masks, to be honest. The challenges that we have is that they're generally disposable. They can be worn more than once until they're soiled or damaged. And I know for some people they can be very irritating and challenging to wear. So we do know they filter better. So it depends on the situation that you're going to be in and who you're going to be with. So if you're going to be in a crowded indoor situation and you have concerns about your own immune system response, then a medical mask is a good idea. And for some people, that may mean wearing a respirator in certain situations, if you're going to a healthcare setting, for example, or if you're going to be around a large group of people. Of course, the other thing that I would say is if you're immune compromised, then now is not the time to be in those settings. So avoiding settings that are crowded indoor settings is important as well. And as I started off with, really, the best mask is the one that you're going to wear and that you're going to wear correctly and that you're comfortable wearing. So we do know that there is definitely protection both from droplets getting out and from you inhaling droplets when you have a good non-medical mask. And those are widely available. They can be reused, they can be cleaned and washed and hung to dry. And so it is really balancing that. And if you're somebody who's vaccinated, who's got a good, strong immune system, you're going to be in certain situations, then I think wearing a non-medical mask, as I do, in those indoor situations that we are indoor public spaces is perfectly adequate. But we do know that for some people, that added protection of a medical mask might be important in some situations if they can't avoid going into those indoor settings. And one way to make it fit better, which can make it more comfortable, is to wear a non-medical mask on top to help get it closer to your face. In terms of the AY 4.2, there was it's a single family cluster, so they were all exposed at the same time. There's 3 cases that we're aware of.
Our last question today goes to Belle Puri, CBC.
My question is for Dr. Henry. Afterwards, Minister Dix, if you could answer in French. Dr. Henry, the additional restrictions that are in place in the north and parts of the interior and Fraser East are set to be removed this Friday. Are you still on track to be able to lift those on Fridays? You seem to be hinting today that more restrictions may be coming for all of us.
Well, what we're looking at are what are the important things we need to have in place across the board as a baseline for all of us as we head through these next few months. Recognizing where we are with respiratory illness, where we are with what's happening globally and what we're seeing in other countries where certain restrictions had been lifted. So we're going to be focusing on that. I've been working with my teams across the province to come out with a more coherent approach, if you will. I expect there will still be additional restrictions in certain areas where immunization rates are low, where transmission remains high, and that includes the north, it includes some parts of the interior, Fraser East. So yes, expect to see some harmonization is what I'm trying to do, but the basics will be the same for all of us. We're going into a challenging period. We don't want this virus to take off again. So what is the things that we need to do to make sure that we can keep it suppressed as we go through this next few months? That includes getting vaccination rates up as high as we can. It includes making sure that we're ready and supportive for young people to get vaccinated when it's approved for use for younger children. That's going to be important in helping reduce transmission in schools, but also in our family settings as well. And all of those other layers that we've been using over time. So yes, those are things that we're looking at in some detail right now.
Oui, je pense que le leadership de la santé publique est en train de considérer toutes les actions. En fait, on fait cela tous les jours, quotidiennement, un peu partout dans la province, mais je veux dire qu'il y aura bien sûr des mesures spécifiques pour des régions où le taux de positivité est élevé. C'est surtout Le Nord, actuellement, où le taux de positivité, c'est à peu près 17%, alors que c'est moins de 4% partout dans la province. Donc, c'est important là-bas. On va considérer cela et il y aura un effort d'harmoniser les mesures un peu partout dans la province. Donc, c'est quelque chose à suivre, sans doute pour la semaine prochaine, mais sans doute on va poursuivre cela. Mais ce qui est évident, c'est que cette période d'hiver va être une période très difficile et un défi considérable pour le système de santé et pour nous tous. Et donc, il faut surtout suivre les mesures de la santé publique actuellement et surtout choisir d'être vacciné maintenant contre le COVID-19 et aussi contre la grippe et d'autres vaccinations qui sont nécessaires actuellement. C'est absolument essentiel pendant cette période et donc tout cela reste important partout dans la province. Mais c'est à suivre, mais c'est quelque chose qui est considéré quotidiennement, surtout dans le régie de santé de l'intérieur, de Fraser et du Northern Health Authority.
Belle, do you have a follow-up?
I do. Dr. Henry, so just a point on your first answer, harmonization. So that could mean more restrictions for all. And then your message is clear about holiday gatherings, keep indoor gatherings small. But is that message, could it be confusing considering it comes after capacity limits have been removed in many locations? Like how safe is it to visit a crowded restaurant or a crowded arena, particularly with unvaccinated children, or when you are going home to them or to elderly relatives?
Yeah, so there's different settings, and we know that risk changes depending on things like how much the space is. So it is less risky in a large open arena, for example, when people are mostly sitting, when they're wearing masks. So that, and where everybody who is there has to show proof of vaccination, versus an intimate gathering where you're not wearing masks, when you're indoors, where ventilation is not necessarily that good. So it varies by the situation. And yes, we know that the things that we have in place are to mitigate those risks. So we know that right now we're seeing transmission in young children. So we have to be aware of that. And that's one of the challenges that we will need to look at as we get through this next few months. But it really is about what are the conditions that allow this virus to transmit more easily, where we see a transmission happening to people even if they're vaccinated. And those tend to be those groups that are coming together where you're not generally wearing masks, so family gatherings, intimate dinners together in an indoor place that doesn't have good ventilation, that is crowded. So those are the situations we need to think about where this virus can transmit very easily. Yeah.
That was the last question.
Thank you, everyone. That concludes today's availability.